So in all the developed countries, we are the only country that will allow somebody to go for more than 25 years without having a medical assessment.
If you go to Europe and you look at a driver and you look at the facilities over there, there's lessons to learn. Unfortunately, that's a different podcast for a different day. You go to America, there's lessons to learn. We need to start learning those lessons, because the one thing that is sure thing is that we are all getting older, and the one thing you can never control is time.
As a female, and knowing my other females, we love to talk about our problems, but men are not quite so good at sharing.
So there's upstream decision making, which has downstream consequences. And actually, if the upstream decision making wherever that is in the organisation had any experience or visibility of what it's really like, the downstream experience, they would do it very differently.
I received an email from a member last night, and there's a stretch motorway outside of Birmingham for 25 miles where there are no toilets that are accessible to coach drivers and truck drivers now. That cannot be acceptable in this day and age.
No.
So coming back to your point.
What are you going to do? You're just not going to drink.
Right.
Essentially, it's the one part that's been utterly forgotten and overlooked. We've had lots of regulations and progress in terms of improving safety, reducing road risk. None of that has involved dealing with and promoting drivers' health.
All these things we are doing, and we are promoting pulling together, but I think it might be if we went and asked the drivers what do they think, what would the answer be? So welcome to Roadway, the podcast, and today we're going to talk about drivers' health, which is a very, very important part of the industry, and it's a significant part of the industry, but it's more than just a traditional view of drivers' health, which we'll unpack and talk around over the next 25-30 minutes. I'm really pleased this afternoon to be joined by Dr. Grant Charlesworth-Jones from D for Drivers and Sally Gilson, our head of policy. So, over the course of the next 25 minutes, we're going to cover a few areas and unpack certain traditional views, I would suggest. But if we could just start off, Dr. Grant, if I may call you Dr. Grant, because it's a long name, is that one?
Yeah, you go ahead.
How big an issue is drivers' health from your observation in the logistics road haulage industry?
Essentially, it's the one part that's been utterly forgotten and overlooked. We've had lots of regulations and progress in terms of improving safety, reducing road risk. None of that has involved dealing with and promoting drivers' health. All the worldwide research says the more healthy the driver, the safer they are on the road. It's a direct correlation.
We'll come back to the definition of health in a moment or two, if we may, because I just want to explore that. Sally, your perspective. So you spend a lot of time with our members. You spend a lot of time in the industry, talking to people across all sections. When we talk about drivers' health, what do we mean by that, or what's their perception of what we're talking? Is it blood pressure? Is it?
I think you immediately think about physical health, but we're not just talking about the physical health. I think that's kind of your obvious ones and the more visible. But we're actually talking about sort of mental health as well, and sort of thinking as well about sort of neurodiversity as well within that. So it's a far broader sort of term for us, and I think, as Grant just said, that it's really important that we concentrate on our drivers and think about, are they fit for the road, and not just think about whether the vehicle is fit for the road.
And too, what do you think when you look at the age profile of and we'll talk specifically about drivers, HGV and coaches, okay? And it's an overwhelmingly male-dominated profession, is that? When you look at the age profile, and you know all these numbers probably better than me, Sally. 35% over 55?
Yeah.
Is it less than 5% under 30?
It's less than 5% and under 25, so it's
25.
a very small percentage of younger people.
And obviously it's a job that, certainly since I started in this industry 40 years ago, has become more and more sedentary, so there's not a lot of movement going on there, certainly for the moment they're sat behind the vehicle. So it would be, and it may be a question for you, Dr. Grant, is this profession more likely to develop conditions, because of the nature of the work than other professions, for example? If so, does that manifest itself in that age profile, or if you're a younger driver, you're just as susceptible?
It's so interesting. Being a vocational driver is actually one of the most dangerous jobs in the world, based on the rates of mortality and morbidity. Morbidity is where you have a chronic disabling condition. And the reason for that is the method of working. As you rightly said, the sedentary element we can touch on dietary choices and various other things, but fundamentally, these drivers are very much under-recognised for the difficulties which their job causes them, and they have double the burden of heart disease, diabetes, and various other conditions compared with somebody of the same age, same sex, who isn't a driver. So they are literally, it's their method of working is what's going to kill them.
Well, again, there's always a stat, and I can't remember, it's a stat that I remember from a medical awareness program, that you should get up and walk around from a desk every 40, 45 minutes or 50, clearly from what you're, and we know they can't do that. So we'll come on to how we can potentially improve that as we go through the podcast. Just you touched upon it as well, Sol. If we can just go back to it's a traditional workforce, look at the profile. So the generations that are in the workplace at this moment in time, if you look at the 5 generations, predominantly the generation that is makes up the bulk of our driver workforce is my generation. Okay, so they will have a certain view of medical, they'll have a certain view of health, and and they're all blokes, and we know that men don't talk about issues like that predominantly. They're becoming better at it, and we should encourage them to do so. So when we ask when we're talking for this podcast about people's health, and you've touched on it before, it's not just the blood pressure, it's not just I pulled the muscle, it's everything else around that. Do you just want to unpack that a little bit more, and just from what you've seen, certainly in the last 3 or 4 years?
I think the thing that I find quite shocking in a lot of the data is that the biggest killer for men under the age of 50 is actually suicide. And as a female, and knowing my other females, we love to talk about our problems, but men are not quite so good at sharing. And I think it's that part of this, we've really got to get this point through, because obviously drivers spend a lot of time on their own. And I think genuinely caring about somebody's mental health is really important. And giving transport managers and planners those just some simple lines and skills to be able to ask someone how they are, and make sure that they're in an environment that someone can actually reply to them. So if we all say, whenever we see someone that we know, "No, how are you?" How often do we actually expect a reply? And if you had a genuine reply of how that person is actually feeling, you're quite taken aback. It's making sure that people have the skills to be able to deal with it. We're not professionals. We're not trying to make everybody a professional in mental health. So it's about being able to encourage people to open up, and then sort of guiding them to that professional health, because I think it is really a silent killer. When you look to the older drivers, again, it probably does become more of a medical, a physical health issue. And Dr. Grant was going through the issues that obviously can affect you when you are in a sedentary job. But that's why it's really important to know what your health is, what is going on, because it doesn't mean the end of you losing your license, because there's plenty that you can put in place to make sure that we keep these drivers fit and in work for as long as they want to. It's really important to be able to retain the drivers that we've got, and there are real simple measures that we can be putting in place.
And so we have an event in the next week, so we are promoting and just launched our guiding to maintaining driver health, and thank you very much for your contribution to that as well, Dr. Grant. And it touches upon there just a couple of, and I pick up on your point totally, being of a generation I've been waiting for a long time, the people's perception of, I've got my medical, I'm all right for another year, I've got my ticket, I'm away, or whatever it may be, is very much still deeply rooted, I would suggest, certainly in the, can you say older generations, but in the older generations that are in the workplace. So new ones are a little bit more aware, I think. And I'll give you an example. If you think, so my son suffers, don't suffer, my son's got the condition dyspraxia, and he's fortunate in many ways, because I'm not laughing at him, so I just always remember when we went for the test. So I went for the test, and basically a specialist said to him, he was only 5, so lay down. So I laid him on the floor. And he said, no, get yourself up. But he was like, and I use this as an expression of his son, he was like a fish flapping about out loud, because he couldn't coordinate to push himself up. And he said to me, he said, you lay down and get yourself up. Oh, this is it. And I could, because fine. And it was about the coordination and the hand-eye thing. Now, whenever I bring my son up, he's up in Newcastle, and he's living up there. I always ask him 2 questions because since he was 25, the last 20 years, I always say, how are you doing? I'll say, how's your mental health? Because I know it can affect him. And I think that's the thing you're talking about, where it just becomes acceptable, you know, and then obviously the thing. But anyway, in the guide to maintaining driver health, is this expression, Dr. Grant, neurodiversity, what's that mean?
So there's a much greater awareness now, both in the UK and lots of other developed countries, about neurodiversity. It's the awareness is there now, but actually, historically, from a medical point of view, this has been long diagnosed. So in a broad sense, you're talking about autism and ADHD, but referring to your son, dyspraxia, dyslexia, dyscalculia are all included within that. And what we're seeing actually now is a big uptick in people being diagnosed with one of these conditions, most notably ADHD and autism. It is worth mentioning that this creates, it gives answers for some people who've experienced difficulty in their life. It gives a medicalization. But then, like everything else, you know, it comes with its difficulties in terms of interfacing people with this diagnosis, because the Equality Act becomes relevant. And certainly when we're looking at medical safety and fitness to drive, it bears relevance because, for example, ADHD, one of the possible pharmacological treatments is a controlled drug, you know, which is a stimulant medication. So you've got the underlying cause, underlying condition, and then you've got potential difficulties with the medication, which is traditionally prescribed. This creates, from an operator's point of view, it's a very difficult thing to deal with potentially.
Well, I think going back to those issues, and I use my expression as, you know, as the father to my son. You know, I think because ultimately an operator, you know, is responsible for the people working for him. He has a legal obligation. He also has a moral obligation. That's my opinion. That's why it's right. And, you know, it took me about 3 or 4 years, you know, because back, you know, I'm going back 20 years, where it wasn't talked about particularly, and information wasn't as readily available, and we didn't have all the IT around us that we have today. And it took me a while to understand it, because one of the ways it really manifests itself in Nathan, you won't mind me sharing this, because he's incredibly untidy and disorganized. So you walk into his room and it's just like a bomb's gone off, you know, and it's just, where's that son? Don't know. What are you doing? Don't know. You know, so you have to structure around to help him. That's not a weakness. I mean, he's got a first-class degree in maths. You know, he's a day traveller, so he's up there somewhere in comparison to that. But I'm very structured. So we're poles apart in that respect, yeah. Intellect, that's my son. Structure, that's me. But once you understand that, once you've like been an employer, I use this as an example, you can create the framework and systems to help and to do that. And I can get the best out of him for him, and away he goes. And actually, that's what you should do as an employer. There's no shame in talking about these things, is the point I'm making. And again, that's one of the reasons why we're producing the document. Moving on a little bit then, and this is because it's a regulated industry, rightly so, it's a safe industry. And we have the driver medical, which everybody looks at, and if you get your ticket, you're fine. Okay? And don't take any seriousness to anybody listening to any in what I'm saying. That is currently legislation. How good are the driver medicals? I'll go to Dr. Grant first from a medical perspective, and I'll come to you, Solly.
So in the UK, we lag behind nearly every developed country in the world in terms of what's in the medical and how frequently we undertake it. So in all the developed countries, we are the only country that will allow somebody to go for more than 25 years without having a medical assessment. So for example, qualifying driving at age of 20, your next medical will be at 45. Speaking from experience, quite a lot can happen between the age of 20 and 45, and I'm sure people would share that sentiment. But to not even have an eye test, whereas your vehicle gets a 27-point walk-around check every time you use it, you're at work 40 however many weeks of the year, day and night shifts, but nobody even looks at your blood pressure. Now we're seeing younger people with blood pressure problems. So people, we still see quite a significant number of people who are age 45 who are breaching that blood pressure. We're also seeing it's just a different generation, and unfortunately things like Xbox and Deliveroo have come in, and that's had an effect. And it's a sedentary upbringing, which has then gone on to a sedentary working. So we're actually seeing, we had an example the other week, a female 40-year-old driver who had a heart attack. So demographically, you wouldn't think 40, you wouldn't think female, but the act of driving is actually one of the most contributing factors. So we can't be age discriminatory in assuming that just because people are younger means they've got better health than the older established workers in the industry.
And I think that's a really powerful point and excellently summarised it. Just because I'm going to summarise it in my language now, and this is how I speak, so I'm not saying. So just because you're an old timer in the industry, doesn't mean to say that you're unhealthy.
No.
Just because you're just come into it, doesn't mean to say you're super fit and can take on the world and the fireproof. So and that's it. I think that's the overall awareness piece. And I went into this. It is relevant. This. I went into Tesco's the other day to just do some shopping. And I was almost like forced to go into the little chemist to have my blood pressure checked. I didn't need it checking, I wanted checking. So you can go and buy a bag of tin of beans and you get your blood pressure checked. You can get into a 44-ton articulated vehicle, and like say for 20 years you can drive around in it and nobody's really paying attention, and that's not the operators or the driver, but as a society there's something disconnecting there, I would suggest.
Yeah, absolutely. And what we're advocating is actually not, it doesn't make any sense that you do all these regulatory, risk management, but the black hole in the risk management matrix is the driver who ultimately is most likely to cause a vehicle to crash. But what we're advocating, actually, we've had a really good uptake on this, is intermittent, what we call wellness checks. And a wellness check is like a mini D4 medical, but it lets you know that you're on course to pass your medical when the regulatory one comes round. And it gives that driver the opportunity to make small course corrections to keep themselves on that vector to pass their next medical.
Yeah, I mean, it's a very personal thing to everybody, really. So every year I have a medical, and it's something I've always done, purely for that reason. Early detection, understanding, and I don't suffer with, but whenever I have my blood pressure check taken in that environment, the white coat environment, I'll be 135 over 90. I go home, I'll be 117 over 72 or something like that. And that's that thing. But the point I'm making from that, again, because I know, and I've done it over a period of time and consistently do it's a discipline, that doesn't worry me, because it's understanding the parameters, if you like. We'll come back if we can to that, because I think there's something in there. But Sally, with all that in mind, from a regulatory perspective and your experience in the industry, what should and are we doing as the RHA to say to support this from a policy lobbying perspective, that we need to help the communication by almost not enforcing but regulating for it, if that makes sense?
So I think we've got a membership who is all about compliance. So they will make sure that they are doing as per the regulations. As we've just discussed, you can have faith in those regulations because you think that they're going to be able to sort of tick the box for you. But I think we do now need a discussion as to whether they are still fit for purpose. We have just generally an unhealthier population, as Dr. Grant has just said. It is not age specific. So I feel like there should now be, at this time of review, of what the regulations are, and just a discussion. I think, obviously, if you are looking at best practice, you are going to be doing more than regulations, just like you would with lots of other things within your as an operator. If you're going to go up above and beyond, then obviously you are going to be putting in those medicals on a more regular basis, much like yourself wanting to know every year. If you're a good operator, there's nothing stopping you from being able to source a health provider, potentially a D4 drivers, and come in and do that general health check, and not just the drivers. This could be for everybody. You don't want to just pick on the drivers, but I think what you also have to think about is that from a driver perspective, they're going to be really scared that they're going to lose their license and their livelihood. So it's making sure that you are creating this safe space so that then when you offer these medicals, they're not going to call in sick that day to avoid it. You've got to make sure they understand that if something is highlighted in that medical, that you can work through it and it doesn't mean a loss of license. Everything, the majority of things can be overcome. And I think it's having that good communication as a manager and your drivers.
That's a really good point. I think as a trade association, the other thing that we do as well is that, and the values are over my shoulder, which obviously the listeners cannot see, and we talk about collaboration, trusted partner, we talk about, quality, we talk about supportive, those are all the things that we should do, and, we have partners in these areas, obviously self-taught to grow, and it's a trusted partner, that's it, and then because we know what you do is reputable, we know it's good, and we know that you're passionate about it. There are grey areas in all areas of life. We've got the mental health support for the drivers, and we did the diabetes chart last year, and all these things we are doing, and we are promoting pulling together. But I think it might be if we went and asked the drivers what do they think, what would the answer be? There's a question. I think we don't have to. What would your view of what it would be?
I think it'd go back to what I just said, that there would be quite a bit of concern, I think, which is why as what you are seeing now is more and more often out on the road at truck stops, there are now safe spaces where you can actually go and get your health checked out. So I actually visited a site, Junction 24 on the M5. They do every Thursday, once a month, they do a health hub.
Yeah.
So a driver can go in without their employer knowing, and be checked out and start that course on their own. Because, like I said, I think there is this fear factor. But there are also other things that you could put in place. So the amount of drivers who complain about how boring their driver CPC is. Yeah. Well, why not create the driver CPC about it? And there's a great new driver CPC module called Shift, which has been written by Loughborough University. And it teaches drivers all about nutrition, how to stay fit and exercise on the road, because it's really difficult, isn't it? You're in a cab. How do you exercise? You can use, with bands, with stretchy bands. You can do all these kind of in-cab exercises. Walk around the vehicle several times to try and get your heart rate up. They come up with loads of ideas. It's a really interesting driver CPC. So from the driver perspective, that's the kind of thing I think you could be doing.
Okay. Well, again, I think the question for you as well, Dr. Grant, it's like the same question but a different way around. And this is a view, because I know that, you see drivers more than we do in this show. I think you do about, is it 100,000 a year?
120.
120,000. So obviously you see a few more than we do, not you personally, but so you're probably more attuned to that. And is it because they're scared of the employer, or they're scared of knowing themselves? And that's the question I often think. So when I'm in medicals in 2 weeks' time, and I'll stop eating cheese wheat before and all that stuff. And then when I go, and it's a 4-hour thing, it's this thing, and then we do the back and all that sort. And I get apprehensive about that, thinking, that means tell me something. But then afterwards, you think, well, it's better to know. But it's that bit before, if it was easy, because, Red, who works with me, she never cancels it, we should cancel out. No, you're going. It's that sort of mentality. Is it really we don't want to know? Or is it we are using the employer to find out so we don't have to go? Just a view and the far view from...
I could give you probably a 3-hour long, very deep psychological explanation, but in brief, let's actually just be a bit grown up about this. Yeah. The transport industry is traditionally quite hardwired in how it conducts itself, and yet it can perfectly embrace progress when it permits itself to. So let's actually, with our grown-up hat on, say, if we check people's health, we will save lives. Yeah. And that discharges what you refer to as your moral obligation. There has not been a month since we've been doing it. And so, for example, in the last 5 years, we'll have seen over 500,000 people. And there has not been 1 month in the last 5 years where we haven't sent a driver to hospital because we picked up something. And, we're operating out of 120 different clinics all up and down the country. And we're meeting drivers from everywhere. And there has not been a single month in the last 5 years where we haven't sent somebody to A&E. Usually it's blood pressure, but fundamentally we pick up funny heart rhythms that leave you vulnerable to having a stroke or a heart attack, a great variety of things. So actually, when you actually get to it, drivers, if you give them the correct and nurturing situation where they can discuss their health, they're quite forthcoming. Everybody's got questions about, am I okay and things like that, and we internalize that. But fundamentally, and what Sally's been saying is, if you actually create a situation where that back and forth reciprocal conversation can flourish, where they can actually feel safe to actually share information, and you can value that and help them, then and the art of creating that situation is where some training is needed. Interesting, if I may just share something with you, which is just news just in, because we're always looking for a digital-based progress. I mentioned being hardwired, but and D for drivers and our occupational health, I'm D for health. We're quite the opposite. But this morning, so we've been working for a long time over the last year or two with Loughborough University. And we have been working on creating a platform that monitors driver health through wearable watches, because it can, with the view of picking up the conditions. So this is not to inhibit you driving. We see ourselves as work enablers. We want to keep people working as productively as possible for as long as possible. So we are enablers. But just this morning, actually, our joint bid has been awarded funding by Innovate UK. So the government are actually supporting that as a project which will bring a lot of health benefits for the transport industry.
Excellent. We need to be pushing that on social media. Sorry, you have to cut that bit out, because we will support that, because I think it's really, really good. Sorry, go on, sorry. I
was going to say, it was a really interesting point there, because that being an enabler, I mean, without sounding quite crass about this, there is a cost perspective with regards to making sure that obviously we are keeping people healthy and drive on the road, because sickness costs the UK economy £85 billion a year. So there is a business case as well.
Investment. I always look at the bidding. I mean, I used to run operations of all shapes and sizes, but I most had 400 drivers working for once, and the driver, and I don't like to categorise people, but they are some of the most resilient, forward thinking, people, in the organisation, not exclusively, because when you think about the road, going back to your point, Dr. Grant, they're isolated, they're on the road, they've got to make instant decisions at the front end of the operation, and they have to, communicate. That's all the attributes of a good driver. So when you think about that, and you think about the pressures that they can be under at the same time, so they get stuck in a traffic jam. Okay, so congestion everywhere, and you look at they get to a site and they're not allowed access to facilities. They get to a site and they're in a queue, and it's all that pressure that's building throughout the day. I'm not surprised that blood pressures are up, and that's not a throwaway comment, but it's a thing. And then they have facilities that are less than adequate. That if we had a choice, we wouldn't stop there. In most cases, not all cases. I'm going back to your point about the investment, where why shouldn't the driver have an annual medical? Really? Like I do, because I do that for two reasons. One is because I enjoy my life, but two is so I can do my job. Because, my job's slightly different to a driver, but it's demanding. It's as all of our jobs are, but I need to know that I can do that, and that's why I do it as an enabler, because something wrong, we'll get it sorted out if we can, and that's it. So I think, and you touched upon something there, Dr. If we can just touch upon. So with all this advancement, and you'll hear people talk about generative AI and predictive AI and all this technological change that's going around us, autonomous vehicles. If you get in the vehicle now, when I started as a big gear stick, you had double the clutch. Now you get in, there's no gear stick. You look at the advances of this equipment. Surely there's got to be opportunity there, and I think it exists. This is my perception. Generations coming in to improve communication and awareness around these things, because you really, the summary you used there was really good. This is an investment. You're there to help the driver drive, not to stop him. And I think the majority of the industry probably still sees it being the latter. So I think, how do we get to a point where you? Yeah,
so I can explain this for our. We do a lot of occupational health actually. So the medicals are becoming less and less of our core business as the occupational health, because we're transport specific, and we're driver. Nobody sees more drivers in the UK. To that end, what we're seeing really is that to really actually get to the nub of this. How best to describe it? I'll tell you how best to describe it. What we're seeing here is that the drivers who are on we'll call it the coalface, they are working as a result. So there's upstream decision making, which has downstream consequences. And actually, if the upstream decision making wherever that is in the organisation had any experience or visibility of what it's really like, the downstream experience, they would do it very differently. So I think that's, to walk in the shoes of a driver for a day even.
Correct.
And I think that would give a lot more education and empowerment for change, because actually having the first-hand experience of what, and the other thing we see is a lot within organisations is what I would call role creep. So people start in one role and then someone is off, so they do a little bit something differently or a bit more, and then before you know it, then they move to a different depot. But so what we're finding from a lot of transport and logistics companies is that the role that we're given for an individual doesn't match what they're currently doing, and what's happened is they passed into some roles which actually require medical fitness to undertake those roles safely. But they've adopted those roles, in the spirit of, best interests and what have you. But they skip the medical part where they actually get a medical sign-off. So we're seeing that more and more. The other thing is that we're seeing as well is as drivers have struggled with longer distance driving, there's a sort of step down. And just as you go into the industry, you have steps up in terms of responsibilities and qualifications. And at the tail end, toward people's end of career, where there's a sort of step down process. And we find that maybe some of the older drivers are now operating just within the yard or doing some shunting or forklift. When we do medicals on them, we're finding a lot of things. But actually, if you think about, if you had a legal problem, you'd call a lawyer to get the best. If you had a financial problem, you'd refer to your accountant. With us as specialist transport, occupational health people, we are imparting a commercial benefit in our independent advice.
So with that in mind, and we are, we've got a few more questions, probably another 2 or 3. One of the things, and this is because you shared some breaking news today, which I congratulate you on, thank you very much. I will share a little bit of breaking news with you, Dr. Grant. One of the things that we're doing this year as a trade association is that on the 15th of July, which you will have an invitation to, it's not got there yet because of a few IT issues, the RHA is having a garden party. That's very nice, it's lovely. And the reason we're doing a garden is we're going to invite 150 representative people from across the industry, and it's where we're going to launch our manifesto over the next 10 years for 1 million moments of wellbeing improvement across 6 areas. So we're going to find the 6 areas, so there'll be exercise, there'll be another thing. And we're going to commit as a trade association to drive change through the industry and behaviours and the members to improvement in these areas. And we're doing it for an obvious reason. I know that people do that. And we're going to be engaging with the, knowledgeable people in each of those areas. It's like a 10-year engagement program, educational process, like you say, and it's about focusing and drilling and shining the spotlight on those specific areas. There'll be more than the 6, but there'll be 6 that are the most relevant to this industry. And they'll tie into things like facilities as well. So that's a little bit of breaking news, which I think you know about, Sally. But we're very excited about that because it's trade associations have to also look to their relevance going forward. And it's not about just giving legal advice, going back to your customer regulation. Half of it now is about people and the environment we're working in communication, and how we can make people more aware, of this space. So it's all very exciting stuff. 2 more questions, I think, if I may, before I close down. So it's been a really good conversation. We've talked around quite a few of the areas. But in terms of, if I go back, 10 years when I was working in the industry, as a owner or an operator of the business, what should I do in this area? What can I do and what should I do to improve the awareness and to improve, the enable my drivers and other members of staff to be healthier and in a better position than maybe where they are today? What can I do? I'll go to you first, I'll come to you. That's great.
I think one bit that we've not touched on yet is hydration. And I think it's something that gets really overlooked. So hydration is key for keeping that mental awareness. You get fatigued if you're not drinking. And what's one of the reasons that you don't drink is because you don't have access to toilets. And it takes it round to this whole facilities issue. So the amount of, I think we've lost 60% of public toilets since 2010.
Just an aside, I received an email from a member last night, and there's a stretch motorway outside of Birmingham for 25 miles where there are no toilets that are accessible to coach drivers and truck drivers now. That cannot be acceptable in this day and age.
No.
So coming back to your point.
Because what are you going to do? You're just not going to drink.
Correct.
Obviously, without getting into the physicalities of this, if you're a male, it's a lot easier. But if you're female, it's not. And I'm saying there are lots of reasons why a female needs access to a toilet. But it's really crucial, and we also sort of mentioned it a little bit earlier, with regards to depots as well. So as an operator, if you are also a warehouse and you've got an area where you make drivers wait whilst they're being loaded, unloaded, what does that area look like? Is there toilets available? Is there healthy food options available? That is a really basic starting point of what you can be doing for drivers. But having that conversation with drivers in the morning, making sure they've got a water source with them whilst they're out on the road, make sure that you have actually set out a work schedule that means that they can properly stop. And we're not just talking about the 45-minute break here. As we get older, we know that men have prostate problems. They probably need to stop more often than 4.
Look at these. Different generation.
Yeah, but there are many reasons why we need to start more regularly than about 4.5 hour shift. So I think that's a really important issue.
So it's about it's going back to the point I think you mentioned it, Dr. Allen, you did as well. So this is not a reason not to do something. It enables and enhances and improves. I don't like using the word productivity when we're talking about people, but it actually enables them to perform better in the workplace. Because, from what you're saying, and I'll come to you with a question in a second. This is about, if you go to Europe and you look at a driver and you look at the facilities over there, there's lessons to learn. Because unfortunately, that's a different podcast for a different day. You go to America, there's lessons to learn. We need to start learning those lessons, because the one thing that is sure thing is that we are all getting older, and the one thing you can never control is time, because you'll never go backwards. I'm an operator. I come to you, Dr. Grant. What can I do to improve my well-being and health of my workforce? What should I do?
In the first instance, if I may say, the best thing you could do is partner up with a quality provider. You've got running partners who do who provide you with services and what have you. Partner up with a quality provider. If you go on the internet now, and I'll just roll back one. What we found is that the more concern that drivers have about failing a medical is they're more likely then to seek out a doctor who will just sign anything off. And if they're going to sign anything off, you've got a driver then showing you a ticket that isn't worth the paper it's written on, effectively, because the vocational license is actually conditional on the medical. So what we've identified is, as I say, if you let your own drivers book their own medicals, there are, regrettably, and we've done a lot of work with the General Medical Council to raise their awareness of this, but there are doctors operating out there who will sign off, they would probably give my dog a medical and pass it. It is as bad as that. We've seen lots of examples. But actually, the most important thing is having, by running with a trusted provider, and there aren't actually that many at all who have got the quality assurances and things like that. But actually you can get some, the driver gets better looked after. You can get anonymized data about your working cohort. How many more people have I got with blood pressure problems compared with the national average? You've got an active partner who, if somebody is off sick and you want to discharge that moral obligation and treat them like a family, you can get them to see an occupational health doctor within 48 hours. They work 7 days a week on our team. And that includes psychologists and psychiatrists, because we've had to start bringing in now for the ADHD and controlled medication. So actually just having a go-to point where you can pick up the phone for, it's one number fixes all of your problems. And what I say, Richard, is if it's got a pulse, we can deal with it.
Yeah. No. And I think, it goes back, and that's what I think is one of the reasons why we align ourselves to go, because the values are very similar. It's about go and get the knowledge. It's one of the words over my shoulder. If we are not experts, we go and find the knowledge, and we go and find the expert, which is you in this case, in your organisation, to give us the knowledge to give to the members, to give to the industry. So it's nothing that anybody should be afraid of. They should actually just, in fact, if you're going to run any business, and we're talking about transport in this case, coaches, trucks, or vans, it's your duty as an employer. That's your job. It's to make sure the people working for you are well looked after, protected, and that's it. Well, I always think, and we've got one final question after this little summary. The purpose of a business is to provide jobs, future purpose for the community it serves, as well as a return for the investment and the stakeholders and the shareholders. It's a two-way thing. You can't have, there's no business with just one of those two things. It just doesn't exist. So, if you know, the time has flown by, but we are coming to the end of the podcast, and I always close with this question. If there is one takeaway you are going to leave for the listeners on the subject we've just spoken about, what would it be, Sally?
I'm actually going to change the takeaway that I was thinking of earlier. I think communication. So I'm going to go back to the neurodiversity point, that 15 to 20% of adults have an undiagnosed neurodiversity. And I think what's really important about this is that if someone doesn't understand what their issue is, then it can get lost. Why is that important? When you say to someone, do you know the height of your cab? And they say, yes. You don't actually know whether they know. So it's about communication, making them communication as simple as possible. Rather than saying, do you know, you say, what is the height of your cab? That way that you discover whether they've actually got a dyslexia, dyscalculia, dyspraxia, all of those things could actually affect someone's understanding of really basic things. So communication styles really do matter.
Dr. Grill?
We've been doing medical for many years now, and we're invested with Loughborough University in undertaking the world's largest set of research into driver health. We're partners with yourselves because we believe in the RHA's ability to actually bring the rest of the country along with its vision. And I think what I'd like to see is in 10 years' time, when we've done our work, we've encouraged people, we've supported, in some cases scaffolded them to be better, we've raised the minimum standards, legislation has improved. If somebody turned around and said, I joined the transport industry because of the health benefits, you will have turned this on its head very successfully.
Okay, no, I mean, I think those are both really good takeaways. I mean, mine would be, because I'm only about to ask me, Sally, I'll always tell the stories, if we can get to a position where everybody does, when I speak to my son, how are you doing? How's your mental health? For example, that is spreading awareness and communication. It's a nice thing to do, and it's the right thing to do. So, killing with kindness is one of my lines, and that's what we should do. Just finally, as well, from an overarching perspective, this is not, as you said, Sally, this is a very regulated industry. It's an industry that is used to being told what to do from a regulation perspective. But yeah, I'm always astounded by the fact that when it comes to something as basic as people's health and well-being on a day-to-day basis, that it's not overlooked, that's unfair, but people will always use it as a reason not to do it. It's the path of least resistance to some degree. And ultimately, these professional drivers, this is a profession, this is a skill, these people, deliver 85% of what's in this road. This is a career, this is an opportunity. I'm very passionate about that because I think it is. And if, again, you go across to Europe or you go to America, they are professionals. They are given medical support. They are given free medical, the private medicals when they join businesses. You can go to Holland and Amsterdam, you see it all over there. So I think we need to learn something that's part of our role as the RHA. But one takeaway for me this afternoon is we need to go and ask the drivers. Let's go and talk to the drivers and then see those questions we spoke about this afternoon and see what feedback we get. I'm sure you're doing that as part of the research, but I think we can support that as well. So, yeah, that was a really good podcast this afternoon. Thank you very much, Dr. Brown. Thank you very much, Sally. And tune in for the next one. Thank you.